Have you or someone you love been diagnosed with cancer? According to the American Cancer Society, cancer affects 1 in 3 people in the United States. With the looming presence of cancer and the lack of a definitive cure, confusion will arise. Guidance will come in the form of an oncology nurse. By the end of this speech, you will understand how oncology nurses support patients, families, and communities in their cancer journeys. As someone with an oncology nurse for an aunt, her dedication has inspired me to extensively research information and articles regarding oncology nursing. Through this speech, you will understand the fundamentals of oncology nurses, the history behind the profession, the services and benefits provided by oncology nurses, and what to expect in the coming future for the profession. To get us started, we will cover the essential roles and requirements of oncology nurses. The requirements and roles of oncology nurses impact the quality of patient and family care. Oncology nurses perform specialized tasks to meet the physical and emotional needs of patients. They manage treatments, care plans, and symptoms. They educate, advocate for, and counsel patients and families. Education and location indicate the roles that oncology nurses can fulfill. The educational requirements for oncology nurses include an associate's degree in nursing or a bachelor's in nursing science, passing the National Council Licensure Exam for registered nurses, 10,000 experience hours with 10 contact hours in oncology, and passing the Oncology Certified Nursing Board exam. Location impacts the availability of care options. Southwestern Georgia communities have higher cancer rates due to the lack of access and information about cancer treatments. Georgia's larger communities have access to resources through research and medical facilities. The Emory University Hospital and Central Georgia Cancer Center help larger communities. The United States is a leading country in oncology nursing, but globally, deficiencies see elevations in cancer death rates. In an interview with Deborah Dunn, a retired oncology nurse of over 40 years at the Phoebe Putney Memorial Hospital, she states that having an oncology nurse familiar with your disease encourages the patient and families to ask questions and trust the nurse. In a 2016 study by the National Alliance for Caregiving, it was reported that 43% of caretakers want support. Now that we understand the roles and requirements of oncology nurses in our communities, we can look at the history that led to them. Oncology nursing is a nuanced profession whose advancements have led to a broader community impact. Oncology nursing in the U.S. has been specialized since the 1940s. In 1947, Columbia University held the first college course in oncology nursing. The beginning of courses and conferences necessitated national organizations. For example, the American Society of Clinical Oncology and the Oncology Nursing Society were established in the U.S. The creation of the International Society for Nurses in Cancer Care in 1984 led to global safety standards. For example, the Cancer Drug Management Guidelines in 1984 and the Standards of Care in 2001 guide nurses. Oncology nursing organizations advocated for the HB 85 bill for biomarker testing in Georgia in 2023. Examples of these organizations are the Southwestern Georgia ONS chapters, the Georgia Society of Clinical Oncology, and Georgia Corps. Moving on from the history of oncology nursing in our communities, we can discuss the services they perform to support our communities. Oncology nurses support our communities through outreach and advocacy. Martha McKenzie, author of the magazine article Not Today Cancer, highlights the importance of research and educational efforts in informing patients about preventative care in southwestern Georgia. Georgia was a primary creator for cancer patient navigators. Advocacy and policy change is an important function of oncology nurses. Examples of policy change in the U.S. are the Patient Care and Hospice Education and Training Act and Cancer Moonshot. Around the globe, oncology nurses are doing what they can to make a difference by Madison Greer tells the story of disparities in care availability within countries and advocating for better care standards. Now that we know how oncology nurses benefit our communities, we can move on to the prospective future for oncology nurses. The future of oncology nurses will see advancements in technology and education. Immunotherapy is being studied and developed as a treatment option. The ONS article, Cancer Nursing's Potential to Reduce the Growing Burden of Cancer Across the World, reports that 30 to 50% of cancer cases can be circumvented through early action. Southwestern Georgia's communities, the women there lack information regarding cancer screening and prevention. Close the Care Gap is a current effort to reduce cancer mortality rates in Georgia through education and access. Specialization has led to improvements in patient care quality. Telehealth is a rapidly expanding tool within the U.S. Examples of developmental technology are biomarkers and precision health. In short, we have covered the ways in which oncology nurses impact our communities. Oncology nurses' specialized roles and requirements affect patient care. History and advancements have a broader community impact. Outreach and advocacy support communities, and technological and educational advancements have improved outreach and care in communities. Oncology nurses are a link between patient care and comprehension throughout history and in the future. How would patient care in oncology be impacted without the headway and influence of oncology nurses? Oncology nurses are the soldiers in the war against cancer. Now I'd like to open up the floor if anyone has any questions. All right, well then I'd like to thank you for your time and your attention.